In this example, we will show how Signifix's visualization technology can be applied to a fairly complex medical example. In this example, we are trying to determine whether there are certain clusters that administer CT scans improperly when a patient is initially diagnosed with acute sinusitis. The outer ring and its elements deal with all codes and procedures that are administered to a patient within 2 months of the initial diagnosis of acute sinusitis. The inner ring deals with the codes that are administered to that patient within the same visit. Each element on the ring will go from blue to red based on whether it has a low or high percentage versus the total population. Reds will generally be bad and blues will generally be good. If we go to the visualization itself, we will see that the data is split up into grouping categories. For example, the age category spans this row right here. The gender category has male and female, so they have 2 glyphs here, and then you have other things such as region, location, type, and month of the year. What we are looking for specifically on here are either rings or individual elements that are orange and red in shape, and specifically trying to tie them to specific categories. In this example, we can see that there are 2 lanes that we want to be particularly interested in, one of which is the race lane, and the other is the location lane. And a tertiary lane that we should look at a little bit is the type lane, for reasons that I will explain a little bit later. Within the location ring, we can see a few individual locations that have red for the CT scan code. In this example, we have a certain location that makes up about 0.5% of the total with 32 patients and 282 codes. It has the highest CT scans per patient on here at almost 0.67 per. Additionally, we can see in another location it has roughly about 1 in 4 CT scans per patient, and this compares to 3rd and 4th locations that have no CT scans per patient. If we weren't looking at CT scans, and were instead looking at another procedure, such as endoscopies, we could see that this also seems to trend along the location lane. As the locations are aggregated together, they are split into academic and private practice fields. As you can see from one type here, there were no CT scans within the same visit or within 2 visits, compared to another, which is the private practice, that has CT scans both initially and within 2 months. So the takeaway from this visualization is that we should further look into the fact that private practices, and more specifically, individual locations, are improperly coding CT scans when the patient is initially diagnosed with acute sinusitis.